Welcome to another edition of Dr. Wallace Says. In today's brief talk, we're going to talk Grad School 101, the difference between master's programs and doctoral programs. So an MA or a master's versus a PhD or a doctorate, kind of interchangeable terms. We're going to talk a little bit about some of the basic differences between these two types of programs. So right now, you are working on finishing your BA, your Bachelor of Arts at Hope. You might have done an AA first, a little 2-year degree at maybe a JUCO or something, but right now you're working on your 4-year college degree, your bachelor's. And once you finish it, now what? Some of you will go find a job. Great. We'll talk about career planning and job hunting in another video. Some of you want to go to school more. Some of you have career aspirations that require that you do a little bit more after your bachelor's. And some of you have decided to go get famous on Instagram or something. I don't know. You have two options basically after grad school. You can go get a master's level degree, or you can get a doctoral level degree. You don't have to do a master's before you do a doctorate. Lots of students think that they're stepping stones. You do BA, then you do MA, then you do doctorate. You can go straight from BA to doctorate if you can get accepted to the program of your choice. So let's talk a little bit about the difference between these types of programs. For a master's degree, you may be getting an MA, a Master's of Arts, in something like psychology or marriage and family therapy. Some degrees they're called an MS, a Master's of Science. Maybe there's a little more research or something you're doing in that program. Some of you are going to get a master's in a related, like a sister field to psychology. You're going to do your MS in school counseling, or a master's, an MSW, a master's in social work. All of these programs are about 2 years of class time. You can do it in a little bit less. You can stretch it out and do a little bit more. It just kind of depends on what your schedule and life are like. But these kinds of degrees allow you to get a license. In the state of California, you need a license to do therapy and some of the related activities that therapists do. If you get a master's in MFT, once you get your master's, you can get a license in the state of California as an MFT or an LPCC. They're very similar licenses and professions. You don't just need the degree for the license, though. You also have to do hours. So even if you complete your coursework in 2 years, you're gonna have some additional hours that you need to complete. Usually at least 1,500 more hours, so like working full time for a year-ish in order to get licensed. A master's allows you to work in a variety of different counseling settings, helping a variety of people, families, couples, perhaps with a variety of problems. Whereas a doctorate is a longer program. 5 to 6 years is the norm, and you will probably either be getting a PhD, a doctorate of philosophy, or a PsyD, a doctorate in psychology. So most psych majors from Hope go into doctoral programs that are called clinical psych, PhD or PsyD. Clinical psych is a general degree that equips you to work with lots of different diagnoses in lots of different populations. It also equips you to get licensed in the state of California as a psychologist. So this is a different type of license than you would get with a master's. You don't just need the degree for the license, though, you also have to do hours. Although in my experience with a lot of doctoral programs, you accrue more of those hours that you need during your degree, but you also have to have 1,500 hours after you graduate. So the requirement for how many hours you need for licensure in master's and doctorate are very similar. I think with doctorates, it's probably a little easier to accrue those hours more rapidly. With a doctorate, you can do a variety of things. The world is your oyster. You have lots of flexibility. You can teach at the college level. You can work in a variety of settings, in hospitals, in schools. It just kind of depends on what your interest is. You can conduct research. You can work for companies who are conducting research. You can perform assessment, doing testing as part of one of the services you offer patients, which tends to pay fairly well. So side by side, right? What am I doing now? Master's versus doctorate. Master's degrees are generally easier to get into. Many of them require a lower GPA standard than most doctorates. 3.4 is kind of like the cutoff. If your GPA isn't a 3.4, it's going to be hard for you to get into a doctorate. The GRE is the graduate record exam. It's like an SAT that you take to get into grad school. Fewer and fewer schools are requiring this, but almost no master's programs require it, whereas many doctoral programs still require it. Again, the doctoral program is taking longer, although both programs are going to require 3,000 hours for licensure. Master's programs like MFT, you have to get 1,700 hours after you graduate. Psych, it's only 1,500 required after you graduate, like the specific requirement of post-grad hours. Whereas in master's degrees, this is my opinion, not everybody might agree with it. A master's degree equips you to work in clinically oriented settings and mental health, helping people with like kind of normal everyday problems. A doctorate is meant to equip you to work in more specialized settings, focusing on less usual problems. So we're not just helping people like adjust to I've got a new job, I'm fighting with my wife. We're treating schizophrenia. We're helping people with major depressive disorder. So you probably are doing therapy, but you're probably also doing something else. Maybe you're teaching, maybe you're doing research as well. You can work anywhere in both of these settings, but in a doctorate, you can work everywhere and at the highest levels. And here's one of the biggest differences. You're going to get paid more with your doctorate. The annual national salary, I looked this up on the like a federal website, annual national salary for somebody with their master's degree in counseling or related field is about $60,000 a year. With a doctorate, it's 80. In Southern California, both those numbers would be higher. For instance, I just looked at the website for the VA, the Veterans Administration Hospital. They are hiring MFTs, marriage and family therapists, at $60,000 a year. Psychologists, they're hiring between $90,000 and $110,000 a year, kind of depending on your experience. So you're going to make a little bit more as a doctoral clinician than you would as a master's level clinician. So which one do I need? We will address this question more fully in another video, but begin thinking about this. What groups of people do I want to work with? Who am I interested in spending my time with? Who do I care about? Or what problems do you want to address in your work? Do you have a deep interest in anxiety or depression? Are you really interested in issues with kids and families? Do you really care about justice at the border? Think about where your head and heart get engaged. We probably want to use that as information to guide your decision making. Or is there a setting you want to work in? If you know you want to work in a hospital setting, if you know you want to teach someday, there are some things that, like, if you know you want to do it, it's going to be a decision maker. Whereas for many of you, it kind of depends on preference. A master's or a doctorate will serve you, and there are other considerations that will help you make your decision. Thank you for participating in this video. I hope it was helpful, and I will see you in another episode of Dr. Wellness Says. Thanks.